What is melanoma? Melanoma, also known as malignant melanoma, is a type of skin cancer that develops from the pigment-producing cells known as melanocytes. Melanomas typically occur in the skin but may rarely occur in the mouth, intestines or uveal melanoma. In women, they most commonly occur on the legs, while in men they most commonly occur on the back. About 25% of melanomas develop from moles. Changes in a mole that can indicate melanoma include an increase in size, irregular edges, change in color, itchiness or skin breakdown. The primary cause of melanoma is ultraviolet light (UV) exposure in those with low levels of the skin pigment melanin. The UV light may be from the sun or other sources, such as tanning devices. Those with many moles, a history of affected family members and poor immune function are at greater risk. A number of rare genetic conditions such as xeroderma pigmentosum also increase the risk. Diagnosis is by biopsy and analysis of any skin lesion that has signs of being potentially cancerous. Using sunscreen and avoiding UV light may prevent melanoma. Treatment is typically removal by surgery. In those with slightly larger cancers, nearby lymph nodes may be tested for spread metastasis. Most people are cured if spread has not occurred. For those in whom melanoma has spread, immunotherapy, biologic therapy, radiation therapy or chemotherapy may improve survival. With treatment, the 5-year survival rates in the United States are 99% among those with localized disease, 65% when the disease has spread to lymph nodes and 25% among those with distant spread. The likelihood that melanoma will reoccur or spread depends on its thickness, how fast the cells are dividing and whether or not the overlying skin has broken down. Melanoma is the most dangerous type of skin cancer. Globally, in 2012, it newly occurred in 232,000 people. In 2015, there were 3.1 million people with active disease, which resulted in 59,800 deaths. Australia and New Zealand have the highest rates of melanoma in the world. There are also high rates in Northern Europe and North America, while it is less common in Asia, Africa and Latin America. In the United States, melanoma occurs about 1.6 times more often in men than women. Melanoma has become more common since the 1960s in areas mostly populated by people of European descent. Melanoma signs and symptoms. Early signs of melanoma are changes to the shape or color of existing moles or, in the case of nodular melanoma, the appearance of a new lump anywhere on the skin. At later stages, the mole may itch, ulcerate or bleed. Early signs of melanoma are summarized by the mnemonic ABCDEF. Asymmetry. Borders irregular with edges and corners. Color variegated. Diameter greater than 6 mm (0.24 in), about the size of a pencil eraser. Evolving over time. Funny looking. This classification does not apply to nodular melanoma, which has its own classifications. Elevated above the skin surface. Firm to the touch. Growing. Metastatic melanoma may cause nonspecific paraneoplastic symptoms, including loss of appetite, nausea, vomiting and fatigue. Metastasis spread of early melanoma is possible, but relatively rare. Less than a fifth of melanomas diagnosed early become metastatic. Brain metastases are particularly common in patients with metastatic melanoma. It can also spread to the liver, bones, abdomen or distant lymph nodes. Melanoma cause. Melanomas are usually caused by DNA damage resulting from exposure to ultraviolet light from the sun. Genetics also plays a role. Melanoma can also occur in skin areas with little sun exposure, i.e. mouth, soles of feet, palms of hands, genital areas. People with dysplastic Nevis syndrome, also known as familial atypical multiple mole melanoma (FAMMM), are at increased risk for the development of melanoma. Having more than 50 moles indicates an increased risk melanoma might arise. A weakened immune system makes it easier for cancer to arise due to the body's weakened ability to fight cancer cells. UV radiation. The ultraviolet radiation from tanning beds increases the risk of melanoma. The International Agency for Research on Cancer finds that tanning beds are carcinogenic to humans. People who begin using tanning devices before the age of 30 years are 75% more likely to develop melanoma. Those who work in airplanes also appear to have an increased risk, believed to be due to greater exposure to UV. Ultraviolet UVB light wavelengths between 315 to 280 nanometers from the sun is absorbed by skin cell DNA and results in a type of direct DNA damage called cyclobutene pyrimidine dimers (CPDs). Thymine-thymine, cytosine-cytosine or cytosine-thymine dimers are formed by the joining of two adjacent pyrimidine bases within a DNA strand. Somewhat similarly to UVB, UVA light, longer wavelengths between 400 to 315 nanometers, from the sun or from tanning beds can also be directly absorbed by skin DNA, at about 100 to 1000-fold lower efficiency than UVB is absorbed. Exposure to ultraviolet radiation, UVA and UVB, is one of the major contributors to the development of melanoma. Occasional extreme sun exposure, resulting in sunburn, is causally related to melanoma. Melanoma is most common on the back in men and on legs in women, areas of intermittent sun exposure. The risk appears to be strongly influenced by socio-economic conditions rather than indoor versus outdoor occupations. It is more common in professional and administrative workers than unskilled workers. Other factors are mutations in or total loss of tumor suppressor genes. Use of sunbeds with deeply penetrating UVA rays has been linked to the development of skin cancers, including melanoma. Possible significant elements in determining risk include the intensity and duration of sun exposure, the age at which sun exposure occurs, and the degree of skin pigmentation. Melanoma rates tend to be highest in countries settled by migrants from Northern Europe that have a large amount of direct, intense sunlight that the skin of the settlers is not adapted to, most notably Australia. Exposure during childhood is a more important risk factor than exposure in adulthood. This is seen in migration studies in Australia. Having multiple severe sunburns increases the likelihood that future sunburns develop into melanoma due to cumulative damage. The sun and tanning beds are the main sources of UV radiation that increase the risk for melanoma, and living close to the equator increases exposure to UV radiation. Genetics. A number of rare mutations, which often run in families, greatly increase melanoma susceptibility. Several genes increase risks. Some rare genes have a relatively high risk of causing melanoma. Some more common genes, such as a gene called MC1R that causes red hair, have a relatively lower elevated risk. Genetic testing can be used to search for the mutations. One class of mutations affects the gene CDKN2A. An alternative reading frame mutation in this gene leads to the destabilization of p53, a transcription factor involved in apoptosis and in 50% of human cancers. Another mutation in the same gene results in a non-functional inhibitor of CDK4, a cyclin-dependent kinase that promotes cell division. Mutations that cause the skin condition xeroderma pigmentosum (XP) also increase melanoma susceptibility. Scattered throughout the genome, these mutations reduce a cell's ability to repair DNA. Both CDKN2A and XP mutations are highly penetrant. The chances of a carrier to express the phenotype is high. Familial melanoma (FAMMM) is genetically heterogeneous, and loci for familial melanoma appear on the chromosome arms 1p, 9p and 12q. Multiple genetic events have been related to melanoma's pathogenesis, disease development. The multiple tumor suppressor 1 (CDKN2A, MTS1) gene encodes p16inc4A, a low molecular weight protein inhibitor of cyclin-dependent protein kinases (CDKs), which has been localized to the p21 region of human chromosome 9. FAMMM is typically characterized by having 50 or more combined moles in addition to a family history of melanoma. It is transmitted autosomal dominantly and mostly associated with the CDKN2A mutations. People who have CDKN2A mutation-associated FAMMM have a 38-fold increased risk of pancreatic cancer. Other mutations confer lower risk, but are more common in the population. People with mutations in the MC1R gene are 2 to 4 times more likely to develop melanoma than those with 2 wild-type, typical unaffected type copies. MC1R mutations are very common, and all red-haired people have a mutated copy. Mutation of the MDM2SNP309 gene is associated with increased risks for younger women. Fair and red-haired people, persons with multiple atypical nevi or dysplastic nevi and persons born with giant congenital melanocytic nevi are at increased risk. A family history of melanoma greatly increases a person's risk because mutations in several genes have been found in melanoma-prone families. People with a history of one melanoma are at increased risk of developing a second primary tumor. Fair skin is the result of having less melanin in the skin, which means there is less protection from UV radiation. A family history could indicate a genetic predisposition to melanoma. Thanks for watching our video. Make sure you subscribe to receive more video related to melanoma, melanoma symptoms, melanoma treatment, and many other everyday health and wellness. Don't forget to leave a comment, hit the like button, and share our video. Thank you so much for watching. Be safe, and stay healthy.